Dr. Shluper, tell us about dental hygiene. I know we learn about it in school, but just give us a little idea. Are electric brushes better than other ones? Soft brushes, hard brushes, are there better flosses than other ones? Is there some mistake which we patients make and kind of don't know about it, which you want to let us know about when we do this type of stuff? Tell us a little bit about mouthwashes. Are they really effective or not? And what are they effective for? Are they effective for what we think they're supposed to be effective, or are they effective for something different only? Go ahead, shed some light on it.
Yes, first, our teeth, now they are taken care so much because of the food that we eat. We tend to eat lots of sweet and not to brush them, and that's how we get those cavities. In the ancient time, there were not as many sweets, so people did not need as much dentist as today. So our ancestors did not have any toothbrush. They probably did not need it. So our teeth originally made not to go to a dentist to get those cleanings with hygienists, with all the flosses and all the instruments. They made naturally to be strong and healthy. But with the food that we eat, we ruin our teeth. We ruin our teeth because of the sugar that we intake, because of the cavities that are made, and they retain additional food inside of them. Gradually the tooth gets destroyed. And when we restore it with fillings, crowns and bridges and all the appliances that we put over our teeth, some of them create more traps to the food. So it's necessary now for us to take care of the teeth because of the food and the restoration that we already have in our mouth.
All right. So how do we do this? What is the way we're doing it? Is it more or less okay, or do we need some additional advice there? Is there a few things we're missing when it comes to taking care of our teeth ourselves without going to a dentist?
Without going to a dentist, we should brush our teeth at least before we go to bed and in the morning when we wake up. We should floss. The floss, many people simply do not know how to floss. If you just insert the floss in between the teeth and start to move it back and forth, you simply sew on the gum, and you would make your gum bleed. There is a way to embrace the tooth and to move the debris from between the teeth. So you simply do not sew till the gum is bleeding. That's the best hygiene that we can take care at home. As far as mouth rinse, there are plenty of mouth rinse. The difference between them, there are basically two kinds of mouth rinses. Those that contain alcohol and those that do not contain alcohol. Alcohol is very good for masking the odor that comes out of the mouth, but it also burns the gums. So we would choose one that does not contain any alcohol. And there are plenty of them on the market. Okay. So avoid of any alcohol.
Would an electric toothbrush, for instance, be better than another one, or not really?
Not really. It really depends on the operator rather than on the weapon.
The operator being the poor guy who has to brush his teeth every night, right?
Yes. If you are a martial artist, you would choose a good martial artist. You would choose any weapon, and you will be fine with that. It does not depend on the weapon itself.
I got it. I got it. All right. Now let me ask you one thing. I was about 15 years ago, I lived for 2 years in India, in Bombay, India. And I have noticed that everybody there was scraping their tongue with a tongue scraper. I've never done that before, never brushed it before. I have, however, started there with a tongue scraper. I do not have a tongue scraper anymore, but I got into the habit of brushing my tongue every time I brush my teeth. Shed some light on that. Is that a good thing, a bad thing? I personally like it. It seems to be making me more fresh, it looks like, but tell me, and if it is a good thing, would a scraper be better than a brush? Should I go back to a scraper?
The scraper is a little larger than a regular toothbrush, so you would brush some more area. On the tongue you will find lots of microbes that contribute to the odor that comes from the mouth. So once you brush it away, you will certainly refresh your breath. So it's a very nice, I would say nice, but it's a recommended procedure to do.
Okay.
Yes.
So we should brush our tongues or scrape them in order to get rid of the deposits which are there. Well, all right. So I'm doing something right. Now, how do I fix this particular problem? And who has a problem, me or my wife? My wife and me, we usually go all together into the bathroom. We do that for 4 or 5 years. I usually finish brushing, flossing, scraping, shaving, and showering, and my wife is still brushing. What is she doing wrong?
She may like it more than you do.
I'm sure she does. Guarantee you that one. So is it maybe a question of what am I doing wrong?
Basically we recommend to brush for 2 minutes. You would divide the mouth into 4 quadrants, and each quadrant you would devote to it 30 seconds. There is no need to be overzealous. She may be scraping the enamel out of the tooth. It's not very...
I keep telling her that, and she keeps telling me, and you are not brushing enough. So we're probably both, I'm probably way under, and she's maybe a little over.
It very much could be. So as long as she does not brushing off the enamel from the tooth, she should be okay. So overzealous brushing is also not recommended.
Well, wonderful. I'm glad. I'll tell her that today. I'll tell her that. I'll ask her, because I don't. I'm always a little exaggerating that I'm totally finished with the brush, with the showering and everything. I'm just trying to point out she does it a lot longer than I. Thank you very much.